Gram-positive cocci in clusters, catalase-positive and coagulase-positive. Identify the bacterium. Staphylococcus aureus. Streptococcus pneumoniae possesses which type of hemolysis on blood agar? Alpha hemolysis, greenish partial. The Lancefield grouping is based on carbohydrate C antigen present in cell wall of which bacterial genus? Streptococcus. Bacillus anthracis produces a poly-D-glutamic acid capsule. Which test demonstrates its antiphagocytic effect in vivo? McFadden reaction, polychrome methylene blue smear. Cooling towers and air conditioning units are common sources of which atypical pneumonia-causing gram-negative bacillus? Legionella pneumophila. Satellitism of Haemophilus influenzae around Staphylococcus colonies on blood agar is due to the release of which factor? Factor 5, NAD. Name the selective enrichment broth used for isolation of salmonella from stool. Selenite F broth. McConkey agar differentiates lactose fermenters by detecting production of which acid? Lactic acid, detected via neutral red indicator. The endotoxin of gram-negative bacteria corresponds to which LPS component? Lipid A. Diphtheria toxin inhibits protein synthesis by ADP ribosylating EF factor 2. Elongation factor 2, EF2. Enterotoxigenic E. coli heat-stable toxin activates which intestinal receptor to cause diarrhea? Guanylate cyclase C. The Elec gel precipitation test is used to demonstrate toxigenicity of which pathogen? Corynebacterium diphtheriae. Clostridium difficile detection in stool by rapid immunoassay commonly targets which two toxins? Toxin A and toxin B. Rice water stools are characteristic of infection with which comma-shaped gram-negative organism? Vibrio cholerae. Smallest free-living bacteria lacking a cell wall belong to which genus? Mycoplasma. Cold agglutinin test-positive atypical pneumonia is caused by Mycoplasma pneumoniae due to antibodies against what RBC antigen? I antigen on erythrocytes. BCG vaccine strain is obtained from attenuated species. Mycobacterium bovis. Mycobacterium tuberculosis cord factor corresponds chemically to trehalose 6,6-dimycalate. Seale-Nielsen stain uses which primary stain? Carbulfuxin. Non-tuberculous mycobacterium causing cervical lymphadenitis in children, Mycobacterium scrofalaceum. Nim protein is the major virulence factor of which streptococcal group associated with rheumatic fever? Group A Streptococcus, Streptococcus pyogenes. ASO titer detects antibodies against which streptococcal enzyme? Streptolysin O. The Quellen reaction demonstrates swelling of capsule of which pathogen? Streptococcus pneumoniae. Foodborne botulism is classically associated with ingestion of toxin produced under improper conditions. Anaerobic, improperly canned foods. Pseudomonas aeruginosa produces a blue-green pigment called Pseudomonas aeruginosa. Pyocyanin. Hot tub folliculitis is caused by which oxidase-positive gram-negative rod? Pseudomonas aeruginosa. Otosis toxin increases CAMP in host cells by ADP ribosylating protein, GI alpha subunit. BCYE, buffered charcoal yeast extract agar supplemented with L-cysteine is required for culturing which pathogen? Legionella pneumophila. Hayseck group organisms are a rare cause of culture-negative infective endocarditis. Which test differentiates Enterobacteriaceae from Vibrionaceae based on oxidase enzyme? Oxidase test. Enterobacteriaceae are oxidase negative. Shigella dysentery type 1 produces which cytotoxin inhibiting 60S ribosome? Shiga toxin. Salmonella typhi capsular antigen role in pathogenesis, inhibits opsonization and phagocytosis. Triple sugar iron, TSI agar, with black butt, indicates H2S production, typical of which genus? Salmonella, also Proteus. Erysipelathrix ricciopathiae infection, erysipeloid, is acquired from handling which food item? Fish or meat? Swine fish handlers. Whale Felix test uses cross-reacting Proteus OETS19 antigen to detect antibodies in infection by rickettsia. Culture of Chlamydia trachomatis best done in cell line, McCoy cells. The Campylobacter species commonly producing Guillain-Barré syndrome post-infection, Campylobacter jejuni. Sciromedium with antibiotics is selective for ulceration of which organism from stool? Campylobacter jejuni. Helicobacter pylori produces urease, which converts urea to X to neutralize gastric acid, ammonia and carbon dioxide. Legionnaire's disease radiologically presents as rapidly progressive unilateral lobar pneumonia. BCG unresponsive childhood cervical nodes yield acid-fast bacilli on culture at 25 degrees Celsius. Organism? Mycobacterium marinum. School of fish appearance in gram stain smear from Schenker indicates which pathogen? Haemophilus ducreyi. Indiana Jones sign, safety pin, in bipolar staining gram-negative bacillus, isolated from buboes, Yersinia pestis. Yersinia pestis virulence plasmid PMT1 encodes which capsular antigen? Fraction 1 F1 antigen. Oxidase positive, pursed, gram-negative rod requiring alkaline peptone water enrichment, Vibrio cholerae. Cholera toxin genes CTXA and CTXB are carried by which lysogenic bacteriophage? CTX-phi. CTX-phage. Enterobacter cloacae producing NDM1 enzyme shows resistance to which antibiotic class? Carbapenems, carbapenemases. Dancomycin resistance in Enterococcus is encoded by extra gene cluster, VAN A and VAN B. Plasmid-mediated AMP-C beta-lactamase confers resistance to which generation of cephalosporins? Third generation, e.g. cefotaxime, ceftazidime. Minimal inhibitory concentration, MIC, is determined by which standardized agar dilution method? E-test or broth microdilution, E-test widely used. Clostridium perfringens alpha toxin exhibits which enzymatic activity? Lecithinase, phospholipase C. Gas gangrene diagnosis on X-ray shows presence of blow in soft tissues, gas, air, radiolucent areas. Porosity rate 120%. Nagler reaction on egg yolk agar demonstrates antitoxin neutralization of lecithinase of which species? Break time 400 milliseconds. Clostridium perfringens. Listeria monocytogenes exhibits tumbling motility at which temperature? 25 degrees Celsius room temperature. Rose spots in enteric fever are due to bacteremia with one serovar. Salmonella typhi. Diagnosis of brucellosis early stage uses which agglutination test performed at 37 degrees Celsius? Standard tube agglutination, right test. Halophilic Vibrio species causing cellulitis from seawater injury, Vibrio vulnificus. Penicillin is the drug of choice for a gram-positive rod showing drumstick spores. Identify the organism, Clostridium tetani. Erythrogenic toxin of Streptococcus pyogenes is encoded by a lysogenic phage and causes which rash? Scarlet fever, scarlatiniform rash. RPR-VDRL tests become positive in secondary syphilis due to antibodies against antigen, cardiolipin, reagin. Dark ground microscopy is used to visualize which motile spirocate in genital lesions, Treponema pallidum. Oval fat bodies in urine cultures contaminated may show swarming motility typical of which genus? Proteus. Speak. While disease represents severe icterohemorrhagic form of infection by which spirochete, Leptospira interrogans. Drip water contaminant causing pneumonia in immunocompromised patients, Pseudomonas aeruginosa, or Legionella. Legionella accepted for water systems. Hyaluronidase produced by St. Pyogenes is also called factor spreading. Oxonese test reagent is freshly prepared tetramethyl p-phenylenediamine, which turns, when oxidized, purple. Moraxella catarrhalis is characteristically DNase positive and butyrate esterase positive, causing infections of which tract? Respiratory tract. Chinese letter or palisade arrangement on gram stain smear indicates which gram-positive bacillus, Corynebacterium diphtheriae. ELISA detecting Helicobacter pylori stool antigen targets which enzyme antigen? Urease. Most antibiotic pseudomembranous colitis due to C. difficile is treated orally with vancomycin or fidaxomicin, vancomycin accepted. The MVI antigen in blood culture media neutralizes complement to enhance recovery of which pathogen? Salmonella typhi. Enterococcus faecalis shows PYR test positive and can hydrolyze which disaccharide, distinguishing it from group D streptococci? Esculin, bile esculin hydrolysis. Speak, prosody rate 10%. Neisseria gonorrhea ferments which carbohydrate, producing acid detectable in CTA medium. Break time 400 milliseconds. Glucose only. Thayer-Martin medium contains vancomycin, nystatin, and which additional antibiotic to inhibit gram-negatives? Colistin. Haemophilus ducreyi requires which X and V factors for growth? X factor only. Hayman. Kingella kingae causes osteoarticular infections in children and belongs to which Hackett group letter? K. Mycobacterium leprae multiplication in foot pad of mice demonstrates its optimum growth temperature of 5 degrees Celsius, 30 degrees Celsius. Pseudomonas aeruginosa colony with metallic sheen and grape-like odor on nutrient agar is due to which pigment combination? Pyocyanin and pyoverdin. Toxin-mediated food poisoning with incubation of 1 to 6 hours after dairy product ingestion suggests which organism? Staphylococcus aureus, preformed enterotoxin. Listeria monocytogenes internalin binds to E-cadherin on enterocytes, facilitating which process? Cellular invasion. Umbrella pattern of motility in semi-solid agar at room temperature is shown by which pathogen? Listeria monocytogenes. CAMP test synergistic hemolysis of St. Agalactiae, group B, is due to CAMP factor reacting with beta-lysine of Staphylococcus aureus. DNS phenomenon distinguishes swarming strains of which genus? Proteus. Penicillin G is ineffective against MRSA because of altered penicillin-binding protein encoded by gene, MEK-A. The MEK-A gene resides on mobile genetic element called staphylococcal cassette chromosome MEK, SCC MEK. Carriage of Corynebacterium diphtheriae is best sampled from which anatomical site? Nasopharynx, postnasal space. Pasteurized milk is tested for efficiency by absence of which enzyme? Alkaline phosphatase. Tetrathionate broth selectively enriches for which bacterial enteric pathogen? Salmonella spp. GAMP test positive arrowhead hemolysis is seen with Streptococcus agalactiae (GBS) when streaked perpendicular to Staphylococcus aureus beta-lysine strip. Urease positive, triple motile true pathogen of urinary tract, showing bull's eye colonies on CLED agar, Proteus mirabilis. Enteric bacterium causing pseudoappendicitis and grows at 4 degrees Celsius on cold enrichment, Yersinia enterocolitica. Clue cells on vaginal smear indicate bacterial vaginosis primarily caused by which gram variable rod? Gardnerella vaginalis. Cedar-Sinai medium is used for isolation of which fastidious gram-negative rod implicated in endocarditis? Bartonella species. The 3-hour sugar fermentation test differentiates V. cholerae from which non-pathogenic Vibrio? Vibrio alginolyticus. Q fever causative agent Coxiella burnetii phase 1 antigen is smooth rough, highly infectious. Smooth, phase 1. Aspergillus multocida exhibits characteristic mousy odor and is transmitted mainly by bite of which animal? Cats and dogs. Fluoroquinolone resistance in Mycobacterium tuberculosis is associated with mutation in gene GIRA DNA gyrase subunit A. Carboxypeptidase test positive anaerobic gram-positive rod causing antibiotic-associated diarrhea. Clostridium difficile. Neisseria meningitidis serogroup B polysaccharide is poorly immunogenic because it resembles which human neural component? Alpha-2-8-linked polysialic acid. In the Kirby-Bauer disk diffusion test, zone diameters are interpreted using standards issued by X-Body. Clinical and Laboratory Standards Institute, CLSI.